Testosterone is more important to individualize for women than men. So a good rule of thumb for this is true replacement TRT for men is usually somewhere between about 80 milligrams a week total, often split into multiple doses, and about 150 milligrams a week. There's obviously outliers. It's usually there for most men. And that's, a difference of about, if you double 80, that's about 150. So there's a pretty good range. Some men might need twice as much. But with females, there is a much larger range, perhaps 5 to 10 times as much. And some women do not need and cannot tolerate any testosterone whatsoever.
And next we have testosterone in highly active menopausal women. So at the end of the day, testosterone is a quality of life drug. It's used off-label at this time for libido, although the UK may beat us to a on-label indication for testosterone in women for libido. In highly active women, they will probably tolerate that better, assuming they have better metabolic health. A woman who does not have good metabolic health, perhaps she's diabetic or pre-diabetic, is likely to get some, hirsutism adverse effects from the testosterone and not tolerate it as well. Certainly not an equivalent dose.
Yeah, that's a good way to look at it. Testosterone is more important to individualize for women than men. So a good rule of thumb for this is true replacement TRT for men is usually somewhere between about 80 milligrams a week total, often split into multiple doses, and about 150 milligrams a week. There's obviously outliers. It's usually there for most men. And that's, a difference of about, if you double 80, that's about 150. So there's a pretty good range. Some men might need twice as much. But with females, there is a much larger range, perhaps 5 to 10 times as much. And some women do not need and cannot tolerate any testosterone whatsoever. Often these individuals have diagnosis of PCOS or androgen dominance or hyperthecosis or whatnot. And some females can tolerate very high doses of androgens. And for those asking, I would consider a very high dose of androgen a total of 10 milligrams subcutaneously injected testosterone cypionate per week in a female.
Yeah, I would agree that's a higher dosing. And, you mentioned PCOS. That kind of caught my eye as well because you have a highly active menopausal woman. And honestly, women with PCOS are often tremendous athletes because they have this elevated testosterone level that allows them to recover from exercise better. And no, just because you go through menopause does not mean that your PCOS disappears. So that's something to keep in mind is that, starting low is generally recommended because you don't know the individual's sensitivity to testosterone, and someone who has PCOS is likely not to tolerate testosterone well, perhaps except for exceedingly low doses.
Yeah, and we've done a standalone podcast on PCOS, maybe 2 of them before. I think we've done 2 of them at this point, so see that for more information. But one other note on that, if you do have PCOS and your provider's putting you on testosterone, and we'll just take 100 milligrams of oral spironolactone, and that will attenuate the side effects, or just get laser hair removal, or just do this or do that, or with the extra wrinkles that the DHT is bringing, just get some preventive botulinum toxin. And none of that is necessarily wrong, except perhaps using spironolactone as a first-line agent. But often after the window of fertility, so no more fertility or conception is desired, and there's also no chance that you would become pregnant unplanned, most often dutasteride at a low or intermittent dose is a better choice than spironolactone for those women, especially if they balance their athletic performance and other areas of their health other than just not getting virilization.
Yeah, it kind of reminds me of, you have a sinking ship or, cracks, and you're just trying to put your finger in and plug all the different holes. And the problem is, it's hey, it's this testosterone that's driving all these things. It's why not block that trash hormone, DHT, and solve some of these problems?
Yeah. Another podcast that we just did on that as well. So we can link that one for those that are interested.